You said there'd be 40,000 extra appointments a week. How many extra appointments were there last week?
Well, we're ramping up right now. We don't get that kind of live data in real time, not least because the data needs to be validated. But we are ramping up, and I'm confident of that. What we will be doing in a matter of days is sending a crack team of clinicians into those hospitals in areas where not only are there high waiting lists, but high numbers of people who are both off work, off sick, and therefore, by bringing waiting lists down, we'll be helping people back to health and back to work. And like to your point, Laura, because I think it's really important we keep on talking about what we are delivering and the change that's already happening since the election. We've solved the junior doctors' strike, so we're not going into this winter with strikes. We have introduced legislation that will ban the targeting of junk food at our children. We've also put in place the funding to put an extra 1,000 GPs onto the front line. This week, the data bill coming before the House of Commons will enable data sharing and record sharing across the NHS, which have the potential to save about 1.5 million hours of staff time a year. So we are already delivering. Of course, there's much more to do, but we've wasted no time in hitting the ground running.
And we'll talk about lots of that, but just on that specific promise, which was a promise you made, sitting in that chair to our viewers, you can't tell us at the moment how many extra appointments there are, but are you confident?
There's a bit of a lag time, but we are ramping up.
And so by when will you hit that target?
I will come back in the one-year anniversary of the Labour government and tell you whether or not we've been able to deliver the 2 million more appointments in the first year of a Labour government.
Let's talk then about another one.
Just to kind of emphasise on this point, though, when we came in, without the immediate action taken by the Chancellor, I would have had to tell the NHS to slow down and to cut the level of activity because of the black hole that we inherited. So the fact we are even making progress is thanks to the, I know not always popular, but tough decisions we are already taking to fix the foundations and the public finances.
Okay, but I want
so we can fix the foundations of our public services.
But our audience wants to